So we'll talk about the following things of the integumentary system. First, we'll talk about the parts of this system. Then we'll talk about the functions of the integumentary system. Then we'll talk about the thin and thick skins. Thin skin, how many layers we have in the epidermis. In the thick skin epidermis, we have how many layers. And what are those layers? We'll talk about that. Then we'll talk about the glands in the skin. And after that, we'll talk about the dermis of the skin and the structure of the dermis. Then we'll talk about the water loss. You know that through the skin we lose water. So we'll talk about little bit about the water loss. This is the first part of the integumentary system. Then we'll go to the second part. Okay. So let's finish the first part of the integumentary system first. So the main organ of the integumentary system is the skin, and accessory structures are hair, glands, and nails. So those are the accessory structures. Important functions. Number one, protection. Skin provides three types of protection. Three types of protections to our body. What are those? Chemical protection, biological protection, and physical or mechanical protection. Chemical protection. Skin secretes low pH chemical. Low pH means, you know, that acidic. So skin secretes acidic secretion, and that acidic secretion can kill the microorganisms. We know that acid can kill the cells or microorganisms. So that is the chemical protection given by the skin. Then skin provides biological barriers or protection. What is that? In our skin we have phagocytic cells. In the skin we have phagocytic cells. What are the phagocytic cells in the skin? Macrophages and dendritic cells. Those cells can engulf the microorganisms and destroy them. That's the biological barrier. Then physical or mechanical barrier is given by keratin and glycolipids. Keratin is a highly specialized protein. Remember that. The skin has those two chemicals. One is called keratin, which is a highly specialized protein. And another chemical that is called glycolipids. Glyco is glucose and lipid is fat. And glucose and lipid together form the glycolipid. And those two chemicals block water and water-soluble substances. So those two chemicals can block the water from entering into the body through the skin. And that is very helpful. You know that many harmful chemicals stay dissolved in water, right? Many chemicals could be dissolved in water, and that can enter into your body through the skin. But those two chemicals, keratin and glycolipids, prevent the water from entering into the body. So those chemicals dissolved in water cannot enter into the body, number one. Number two, just think that when you sit in a bathtub for a long time, when you sit for a long time, right, in the bathtub, it's very comfortable hot water. If your skin lets the water enter into your body, then what will happen? Your body will get bigger, 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 right? And when you come out from the bathtub, it will be huge. So you don't want that, right? So your skin has those two chemicals that prevent the water molecules from entering into the body. Okay, so that's the physical or mechanical protection. also you know that some chemicals like poison ivy. Poison ivy is prevented by those two chemicals from entering into the body. So that's the mechanical or physical protection. Number 2, body temperature regulation. Regulation of body temperature is another important function of the integumentary system. You know that skin has the sweat glands, and when your body temperature increases, sweating occurs. Why? Sweat is nothing but mainly water, and when water gets out from the body, it takes a lot of heat out from the body, because water has high heat capacity. It can hold, we have talked about that, it can hold a lot of heat. So when even a small amount of water gets out from the body by sweating, it takes a lot of heat out from the body, and your body temperature goes down. Cutaneous sensations. Skin houses cutaneous receptors. What are the cutaneous receptors? Your pain receptors, temperature receptors, touch receptors, those are present in your skin. And because of the presence of those receptors, pain, touch, temperature, those receptors, you can feel those sensations. You can sense those sensations. And those are very helpful, right? Metabolic functions. With the help of sunlight, you already know, with the help of sunlight, skin produces a chemical that is called cholecalciferol. And that cholecalciferol is an inactive vitamin D. And the cholecalciferol from the skin then goes to the kidneys. So from the skin, that inactive vitamin D, which is cholecalciferol, goes to the kidneys. And within the kidneys, cholecalciferol is converted to calcitrol, which is an active vitamin D. So your skin produces cholecalciferol, which is an inactive vitamin D. Then from there, cholecalciferol goes to the kidneys, where it is converted to calcitrol, which is an active vitamin D. Okay, so that's why we say that skin helps in the synthesis of precursor of vitamin D. Excretion. Through your sweating, some nitrogenous waste, metabolic waste, get out from the body. Also, some salts get out from the body. Those are unnecessary metabolic waste. They get out from the body through the skin with the sweat. And you know that if you touch your skin when sweating occurs, you will feel salty, right? So some metals, metabolic waste, get out from the body. That's the excretion. Okay, now we talk about different types of skin present in our body. We can divide the skin in two different ways. Number 1, which is more important, thick and thin. Thin skin covers most of the body, and thick skin is present in particular areas. For example, your palm of the hand, your sole of the foot, those areas have thick skin. Now, what is the difference? Main difference between thick and thin skin is that thin skin epidermis has 4 layers, and thick skin epidermis has 5 layers. So let's first see. The skin has, you have seen the structure of the skin in the lab. Skin has epidermis, then dermis, and then under the dermis, you remember a lot of fats, adipose tissue. That is hypodermis. Now, remember that hypodermis is not a layer of the skin. It is below the skin. So we don't consider hypodermis as a layer of the skin. If I ask you, skin has how many layers? Epidermis and dermis. outer layer is the epidermis, inner thick layer is the dermis. Hypodermis is not a layer of the skin. Now, in thin skin, the epidermis has 4 layers. 1, 2, 3, 4 in thin. But in thick skin, epidermis has 5 layers. Okay, that's the difference. We'll see which layers are present in thin and which ones are present in thick skin. Just remember that thin skin epidermis has 4, thick skin epidermis has how many? 5. Very good. Now, another way we can divide the skin, that's by looking the hair, presence or absence of hair. Hairy skin and non-hairy skin. Okay, so those are the 2 ways we divide the skin. Okay, so hypodermis is not a layer of the skin. It is also called subcutaneous. Cutaneous means skin, sub means below. So subcutaneous layer is the hypodermis. Another name of hypodermis is subcutaneous layer. Now, subcutaneous layer contains a lot of fat, and this layer, although it is not a layer of the skin, is used for subcutaneous injection. You know that you can inject the drug in different routes. You can directly inject into the muscle, you can inject directly into the vein, that means into the blood, or you can inject the drug under the skin. This is the layer, hypodermis or subcutaneous layer, where subcutaneous injection is given. Okay. Why we use subcutaneous injection? If you want any drug to work for a long time in your body, slowly it will work in the body, you will prefer to inject it in the hypodermis. If you inject directly into the blood, then it will work very fast, okay, and for short time. But from the hypodermis, it will slowly be taken into the blood. Okay. Important structures found in the skin. In the skin, you will find glands, sweat glands and sebaceous glands. Then you will find hair follicles, hair roots. In the skin, you will find cutaneous receptors that we have already talked about, blood vessels, and tiny muscles. Those are called erectopili muscle. And another information is that epidermis is avascular. Absence, A means absence. Avascular means absence of blood vessels. No blood vessels are present in the epidermis. Blood vessels are present only in the hypodermis. Okay? How can epidermis get nutrition and oxygen? By diffusion. So from here, from the dermis, epidermis gets the oxygen and nutrition by diffusion. There is no direct blood vessels into the epidermis, in the epidermis. Okay. What are the different types of cells you will find in the epidermis? In the epidermis, the most common cells are squamous epithelial cells. That means flat cells. And those are keratinized. Many layers, stratified, right? Stratified squamous epithelium. And you remember probably in the lab part, in last lecture, I have mentioned that there are 2 types of stratified keratinized epithelial tissue are present in our body. One is keratinized, another is non-keratinized. keratinized type is present in the dry areas, and non-keratinized stratified squamous is present in moist areas, like inside your mouth, right? And dry is your skin. So skin has keratinized stratified squamous type epithelium because it is the dry surface. Now, other cells of the epidermis are keratinocytes, melanocytes, dendritic cells, and tactile cells. So those are other cells present in the epidermis. But most common type is stratified squamous, many layers of squamous cells. Now, keratinocytes. You remember when I talked about the function of the skin, I mentioned that mechanical protection is given by a highly specialized protein that is called keratin. Do you remember that? Keratin. So keratin is produced by keratinocytes. Keratinocytes produce that highly specialized protein that is called keratin in the skin. Then melanocytes produce melanin. Melanin is brown to dark colored pigments present in the skin, and that gives the color of the skin. You know, some skins are darker than others, so more melanin means more dark. So melanocytes are the cells that produce that dark to brown pigments. That's the melanocyte. Melanin. Then dendritic cells are phagocytic cells. Dendritic cells are phagocytic cells. And tactile cells are touch receptors. So those are some other cells present in the epidermis of the skin. Remember, we are talking about epidermis. You have seen this picture before. So you see the layers of the skin. Outer thin layer is the epidermis, and inner thick layer is the dermis. Look at the left side, epidermis and dermis. Then hypodermis is below the dermis. It contains a lot of fat. You see the yellow round structures, those are fats. And in the epidermis, you have seen different types of cells are present. We have just talked about those cells. And in the dermis, you have many different types of structures. What are the structures present in the dermis? You need to know. You see the hair follicles, hair roots, sebaceous glands, sweat glands, Pacinian corpuscle, then blood vessels, erector pili muscles. All those structures of the skin are present in the dermis. So I am repeating again, the epidermis is thin, dermis is thick. Epidermis has how many layers? In thick skin, epidermis has 5. In thin skin, epidermis has 4. Very good. And those layers contain different types of cells. We have talked about those cells. Most common type is the stratified squamous. And in the dermis, you have different structures like blood vessels, muscles, glands, right? Hair roots, hair follicles. Those structures are present in the dermis of the skin. Now, you know that epidermis has 4 or 5 layers. We'll see what are those layers. If you start from the innermost layer, innermost one is the stratum basal or basal layer. And it is formed by a single layer of stem cells. So this layer contains stem cells. So if I ask you which layer of the epidermis contains the stem cells, that's the stratum basal. since this layer contains stem cells, this layer is also called stratum germinativa. Germinal cells. Stem cells are also called germinal cells. That's why this layer is also called stratum germinativa. Those cells can multiply very quickly and produce new cells. Those are stem cells or germinal cells. Then, since this is the deepest layer, after a new cell is produced from the stem cell, how long it takes that cell to reach to the most superficial layer? It takes 25 to 45 days to reach from the bottom innermost layer to the outermost layer. We know that we lose the skin, superficial cells of the skin. So continuously we are losing some cells. Some cells are dying and getting detached. So new cells should be produced from the stratum basal layer because the stem cells are there and will move up. Okay? And for a new cell, after it is born, it takes 25 to 45 days to reach to the superficial most layer. Then above the basal, you have stratum spinosum. It is also called prickly layer. Why it is called prickly layer? Because if you see the cells of this layer, the cells have many spines. Spine like sharp projections in the cell membrane. That's why it is called spinosum. Many spines are present. Okay. Then stratum granulosum. Why this layer is called granulosum? Because if you see the cells of this layer, the cells are filled with granules. Granules are tiny dot-like chemicals. Okay? So those are filled with granules. That's why this layer is called granulosum. Okay, then you need to know what granules are present in the cells in granulosum. The granules are keratohyalin and lamellated granules. Those two types of granules are present or found inside the cells of granulosum layer. Then stratum lucidum. This is the layer which is present in the thick skin but absent in the thin skin. Remember that. Stratum lucidum. This is an extra layer in the thick skin. This layer is also called clear layer. Why? Because this layer is like a glass, thin piece of glass and transparent like water. So that's why this is called lucidum or clear layer. Okay? And then outermost or superficial most layer is the stratum corneum. And in this layer, many dead stratified squamous cells are present. Okay? Most of the cells are dead stratified squamous. That means many layers of flat squamous type of cells. And although the stratum lucidum, that layer is present in the thick skin and absent in the thin skin, but that layer doesn't contribute to the thickness of the thick skin. Which layer contributes to the thickness of the thick skin? That's the stratum corneum, which is present in both thin and thick skin. But in thick skin, stratum corneum is very thick, like just I'm showing. It's not of course like this. If in thick skin, stratum corneum is like this, the thin skin, stratum corneum is like this. Okay, so that layer actually gives the thickness of the thick skin. Although this layer is present in both thick and thin, it is much thicker in the thick skin, and that continues. So if I ask you two different types of questions, I can ask. One is, how many layers in the thick skin epidermis? 5, right? Then which layer is absent in the thin skin epidermis? That's the stratum lucidum. But if I ask you that which layer contributes to the thickness of the thick skin, that's not the lucidum, that's the cornea. Okay? Here, if you compare the thick and thin skin, this is the thick skin and this is the thin skin. You see here, this is the stratum lucidum layer, which is present in the thick skin, not present in the thin skin. But see here, stratum cornea of thick skin is very thick compared to the stratum cornea of thin skin. So this layer is actually contributing to the thickness of the thick skin, is responsible for the thickness of the thick skin. Okay. In this picture, you can see 4 layers of the epidermis. I'll quickly go over. So this is a thin skin epidermis, of course, since they have shown 4 layers. This is the stratum basale or basal layer. These are the stem cells. Okay? These are stem cells or germinal layer cells. And then you see spinosum, stratum spinosum. If you see the cells, many spines, sharp processes are present in the skin. If you look carefully, you can see those spines. Then granulosum, you see many dark granules in the cell. And then these are the dead squamous flat type cells, multiple layers, right? So stratum cornea. This is just a picture, so you can ignore that. Keratinization. Keratinization is the process by which the dead squamous cells get filled with keratin. Keratin is what? Keratin is a highly specialized protein. I have mentioned a few times already. Keratin is a highly specialized protein. And which cells produce keratin? You already know that. Keratinocytes. So keratinocytes produce keratin. So if this is a keratinocyte, this cell, keratinocyte, produces keratin, that protein, and secretes keratin to the outside of the cell. And then what happens? Squamous cells, most of them are dead. Dead squamous cells get filled with those keratin molecules. Okay, so two things here. Keratinocytes will produce and secrete keratin, and then that keratin will go where? Will go inside the flat squamous cells. Dead flat squamous cells will be filled with keratin. Now, this process, how the dead flat squamous cells get filled with keratin, that process is called keratinization. Okay, so these are keratinized cells. Okay, so these flat squamous cells are now filled with keratin and will become keratinized cells. So two different types of cells here you see, keratinocytes and keratinized cells. You need to know the difference. Keratinocytes produce and secrete keratin, and keratinized cells get filled with keratin. Okay? Okay. So we have talked about the epidermis. Now we talk about the dermis. Dermis is located between the epidermis and hypodermis, and most of the skin structures are present in the dermis that I have already shown to you. Then in the dermis you have two layers. Dermis has two layers. Outer layer is called the papillary layer and inner layer is called the reticular layer. So you see here the dermis again. So this is the dermis, and outer thin part is the papillary layer, only this much. Okay? And most inner part is the reticular layer. The reticular layer is much thicker than the outer papillary layer. Now you need to know that which layer is formed by a kind of connective tissue. The papillary layer is formed by areolar connective tissue. You already know areolar connective tissue, and areolar connective tissue contains collagen, that red colored and dark hair like elastic fibers, right? You already know that. So papillary layer is formed by areolar tissue, and reticular layer, which provides 80% thickness of the dermis, and it is formed by dense irregular connective tissue. Okay? So remember that dense irregular is present in the epidermis, in the reticular layer of the dermis. I may ask those questions that the reticular layer is formed by what type of connective tissue, papillary layer is produced by what type of connective tissue. Okay? Papillary is loose areolar and reticular is dense irregular. Okay. Now we'll talk about water loss through the integumentary system. We lose water from the body in many different ways, but we can divide those processes into two types of water loss: insensible and sensible. Insensible water loss are the losses that we don't feel, we don't see that we are losing water. That's why it is insensible. We cannot sense, we don't sense that we are losing water. When you breathe, you lose water. During breathing, we lose water. When we talk, like I talk a lot, right? Every day when I'm talking, I'm losing water from my body. Okay? So water molecules are getting out. But do you see that? You don't see that? So those are insensible. When even you are sleeping, through the skin, not sweating, through the skin continuously, the water molecules are getting out from the body. It is not sweating, it's different. This is called evaporation through the skin. That's insensible, we don't see. But which are sensible? When you urinate, you see that water is getting out from the body, right? So that is the sensible water loss. Sweating, you can see, you can feel that water is getting out from the body. So those are sensible type water loss. Okay? Just know that insensible and sensible, which are insensible, which are sensible. Skin color. In our skin, we have a number of pigments, different types of pigments, and those pigments have colors, and because of the colors of the pigment, the color of the skin is different. So melanin, I have already talked about that, brown to dark colored pigments, and in the dark skinned people, they have more melanin in their skin. White colored skin has less melanin. Okay? So you know that some people have more melanin and some people have less melanin. and that is one thing. Melanin is good for the body because melanin, that pigment, can make a protective shield in your skin that prevents the UV radiation from entering into the deeper part of the skin. So just know that melanin is good for the skin because melanin prevents the UV radiation from entering into the deeper part of the skin. And radiation is harmful, you know that. UV radiation can cause the injury to the cells. So that is one thing. Then carotene. Carotene is orange, yellow to orange colored pigment. And in human skin, we have very trace amount, very small amount of carotene we have in our skin. But in some vegetables or fruits, they have a lot of carotene. For example, carrots.
Yeah, is that why we eat so many carrots?
You want to eat carrot?
You can turn on.
Yes, because carrots have a lot of carotene. That's why their color is orange. Skin of the orange is filled with carotene. Okay, so if you eat more carotene, your skin will get the carotene. If you eat a lot of carrots, then your skin can turn to orange a little bit. Hemoglobin. Hemoglobin is red colored pigment, okay, and present where? In the red blood cells. Hemoglobin is red colored pigment present in the red blood cells, and that's why the red blood cells are red. Very simple. They are red because of the presence of hemoglobin, red pigment. And hemoglobin is responsible for the pinkish hue of the skin. Sometimes you will see if someone's blood pressure gets higher, hypertension, or when you get excited, more blood flows in the face and your face turns pinkish. The reason is that more blood is going there, more hemoglobin is going there. When hemoglobin comes out from the red blood cells, they turn to yellow. When they come out from the red blood cells, they turn to yellow, and that is called bilirubin. So bilirubin is actually is formed from hemoglobin, comes from hemoglobin when the hemoglobin gets out from the red blood cell. So if more red blood cells are destroyed in your body, then more hemoglobin will be produced, right? Because when hemoglobin comes out from the red blood cell, it is converted to bilirubin. So if in your body a lot of red blood cell destruction occurs, then more bilirubin will be produced and your skin will turn to yellow. That is called the jaundice. Yes.
Is that like the babies who have to put up in the whites?
Yes, yes. Then that is called physiological jaundice. That is jaundice because of the excessive destruction of the red blood cells. Okay. You know that she asked that sometimes you will see that infants, they get jaundice, yellow coloration of the skin. Why is that? The main reason is mother's blood still circulates inside the fetus body, right? And eventually, we know that red blood cells stay alive for 3 to 4 months. So those red blood cells from the mother's body are present in the infant. They will be destroyed in the infant body. Okay, so that's the reason we see jaundice. Clinical implications of skin color. Skin color provides us with some important information about some clinical conditions. By looking the skin color, we can detect some diseases or clinical conditions. So, what are those? One is anemia. You know that anemia is the decreased amount of hemoglobin. If in your blood the hemoglobin concentration goes down, that is anemia. So, hemoglobin is red colored pigment, we know that. So, if you have less hemoglobin, your skin will get pale. Hypertension, high blood pressure, you know that how you can detect, as I have already mentioned. If someone's blood pressure increases, you will see the flashing of the face. Face gets, kind of pink or red color. That is the indication of hypertension. Flushed skin, particularly in the face. Jaundice. If excessive destruction of red blood cells occur, breakdown of red blood cells occur, then hemoglobin will come out, will be converted to bilirubin, and that will give the color of the skin yellow. That will make the skin color yellow. Okay, so that is jaundice. Cyanosis. Cyanosis is bluish coloration of the skin. If you in your body you have less oxygen, less than normal, if you suffer from lack of oxygen, then what will happen? Your skin color will be bluish, and that is called cyanosis. If you go on the top of the high mountain without any oxygen cylinder, what will happen? The oxygen in your body will go down, because in high altitude you will have less oxygen, right? So your skin color will turn to blue. That's due to more carbon dioxide but less oxygen in the body. Okay? So that is another clinical condition that you can detect by looking the color of the skin. Do you have any question? Do you have any question? No? Now we'll talk about the glands in the skin. Before we talk about the glands in our skin, I'll talk about the classification of exocrine glands. Skin glands, first remember that skin glands are exocrine type glands. They are not endocrine glands, they are exocrine glands. And we divide the exocrine glands of our body into three different types. We divide the exocrine glands into three different types based on the mode of secretion. Based on what? The mode of secretion. Can you close that door? Someone? Yeah. So, okay, so we see how the secretion occurs, and by looking at the way of secretion or mode of secretion, we divide the exocrine glands into three types. So, merocrine, apocrine, and holocrine. In case of merocrine glands, cells secrete their substances by exocytosis. What is that? These are the exocrine gland cells. And what happens in merocrine type of secretion? First, the vesicles are formed. These are called vesicles. Okay? Round membranous structures. Then those vesicles will get filled with the chemical molecules. The chemicals will fill those vesicles. Then what happens? The vesicles will move to the apical end the upper end of the cells. This is the basilar membrane. So the vesicles will move to the apical end or upper end of the cell and then will rupture and the chemicals will get out. Okay? So that is exocytosis. The rupture of the vesicles, breakdown of the vesicles and the release of the chemicals from the vesicles to the outside of the cell. Okay? In merocrine glands, the secretion occurs in this way. This is called merocrine type of secretion. Then in apocrine glands, what happens? It's a different type secretion. In apocrine, these are the cells again. In apocrine glands, what happens? No vesicles are formed. The chemicals will go to the upper end like this. Will accumulate in the upper ends of the cells. Okay, and then the whole upper part of those cells will be destroyed, will be shed out. Okay, so whole upper part, the cell membrane will be destroyed in the whole upper part. So you see what will happen? The chemicals will get out. Now from here again, so the chemicals will get out because of the destruction of the upper part. Then from here again new upper part will be reproduced, will be formed. And then again the chemicals will start to accumulate there, and again the whole upper part of the cell will be destroyed. Okay, the chemical will get out from the cell. Yes.
What's that called again?
This is apocrine, the middle. Yeah. Apocrine type of secretion from the apocrine glands. Holocrine. I don't know if any of you have heard the term holocast. Holocast. Have you heard that? How many of you are familiar with this word? You? Have you heard that? What is that?
Holocaust?
Yeah. No, I'm asking you.
Total destruction?
Yes. You didn't hear that? Oh, you did? In World War, Germany, right? We say that Holocaust took place. That is what? Destruction, killing, right? So, in holocrine type of secretion, what happens? The cells are destroyed completely. Complete destruction of the cells. So, like these cells are filled with chemicals. Okay? What will happen? The whole cell will be destroyed. So all the chemicals will come out. So in this case, new cells should be produced. Completely new cells should be produced. In this one, you don't need to create new cells because cells are still there. In this case, apocrine, when we talk about that, only upper part will be destroyed and will be reproduced, right? So the cells are not dying completely. But in holocrine secretion, the cells will be destroyed completely. So the chemicals will come out, but new cells should be produced. Completely new cells should be produced. Now, you know different types of exocrine secretions and glands. Now we'll talk about the skin glands. Two types of glands we see, two types of exocrine glands we see in the skin. Sweat glands and sebaceous glands. Two types of sweat glands are present in the skin. One type is called eccrine sweat glands. Those are merocrine. We have just talked about merocrine type of secretion. So that is one type of sweat glands. And another is apocrine sweat glands, because the secretion is apocrine type of secretion. Okay. Now, eccrine or merocrine glands, the secretion is very watery. The secretion is highly watery secretion. Apocrine sweat glands secrete more oily substances. So, the apocrine secretion is oily secretion. The eccrine or merocrine secretion is highly watery or water-like secretion. Okay? In eccrine secretion, 99% of sweat is water. So highly watery, 99% is water in the sweat. And other chemicals like salt, sodium chloride is salt. You know that's why the sweat is salty. Vitamin C antibodies and some metabolic wastes get out from the body. Another information about eccrine is this type of sweat glands are responsible for thermoregulation, regulation of body temperature, thermal body temperature regulation. So just write it down, this is important. Okay. Apocrine sweat glands are present, confined to axillary and anogenital areas around your genital organs and anus. Around those areas we have apocrine sweat glands, and the secretion is oily, and that secretion can retard or inactivate the microorganisms. In the axillary area and around the anogenital area, you will find that type of sweat glands. We know that those areas are closed areas, so chance of microorganisms grow there is more. Okay, so if you see the sweat glands, these are the sweat glands. This is the sweat gland, and sweat gland is like coiled tube. If you put a long tube, coil it together, and that is the sweat gland, coiled tube-like structure. And so it's like this, coiled tube, and the tube will extend all the way to the surface of the skin. This is the surface of the skin. So this is the sweat gland. The duct or tube part will go all the way to the surface, and this is the pore. You are through that opening, the sweat will get out. Okay. Now, sebaceous glands are these glands. They stay attached to the hair follicles. Okay, so they are attached to the hair follicles, the sebaceous glands. Sebaceous glands are widely distributed in our body, and most of them develop from the hair follicles. That's why they stay attached to the hair follicles. Why they are attached to the hair follicles? Because they develop from the hair follicles. And these glands, sebaceous glands, become active at puberty. Okay, so in early life we don't have the sebaceous gland. We have, they are not active, but at puberty they become active and secrete a chemical that is called sebum. So sweat glands secrete sweat, and sebaceous glands secrete sebum. Okay, and sebum is highly oily holocrine secretion. Now you got the holocrine type of secretion. That means the cells of sebaceous glands will be destroyed completely to release the sebum. Holocrine. Sebum has bactericidal actions. That means sebum can destroy the bacteria, bactericidal action. Another function of sebum is it makes the skin soft and oily. Skin and hair too. It makes the skin and hair soft and oily because it is oily secretion. So if you have a lot of sebum secretion, you don't need to use the lotion. Okay? Yes, you don't need to use lot of lotion because it is an oily secretion. Okay? Correct? Any question? Anybody? No question? Understood everything? Okay. You see in the left side, this is the histology of sebaceous gland. So you can see the hair follicle, you can see the sebaceous gland is attached to the hair follicle, and sebaceous gland is filled with the cells. Those cells produce sebum, but when the secretion will occur, those cells must die, must completely be destroyed. Then the sebum will get out. The new cells will be formed there. Okay, now we'll see the structure of the hair. Hair consists of dead keratinized cells. That means the dead cells filled with the highly specialized protein that is called the keratin. Okay. The difference between the keratin present in your skin and in your hair is that in case of hair, the keratin is hard type keratin. In case of your skin, the keratin, that protein is soft keratin. Okay, so that's the difference. In here, we have hard type keratin. In the hair, we have pigments, and that provides the color of the hair. You know, someone's hair is very dark, someone's hair is light, dark, or brown, or white. Why? Because of the amount of melanin at pigment. Okay. Gray or white hair has decreased melanin production. So if the melanin production decreased, then the hair turns to gray or white. And we know that when we get old, the synthesis or production of melanin declines. And that's why the hair turns gray or white. Okay? Let's see some of my hairs. My hair is turned to white. Okay. If you see the structure of the shaft part of the hair, you know that hair has different parts, right? The part you can see from outside, this is the shaft. And inside the skin, you have the follicular part, then hair root, right? So those are other parts. Now, if you see the structure of the shaft part of the hair, it has 3 layers or 3 structures in it. The outermost layer is called the cuticle. Then the middle structure is the cortex, and then innermost structure is the medulla. So cuticle, cortex, and medulla. Remember, we are talking about only the shaft part of the hair. If you cut this hair, then you can see those 3 structures. But if you see the follicle of the hair, you will see additional layers around the shaft. Because what happens, you see, if this is the skin, outside of the skin, the part you can see, this is the shaft, and it has those 3 structures. But the hair is going inside the skin, and this is the follicle. So now, if you cut here, inside you will see the shaft, right? Because shaft is going in like this. So you will see inside the follicle, you will find the shaft, those three structures, but around that shaft you will find other structures like this. Okay, so we'll see the additional structures around the shaft in the follicle. So if you cut the follicle of the hair, then you will see those three structures in the inner part. That's the medulla, cortex, and cuticle. Those three. Then additional layers are internal epithelial root sheath. Next to that, we will find external epithelial root sheath, and then you will see a glassy membrane, transparent membrane or layer, and then outermost layer is the connective tissue root sheath. In this part, just remember, if I ask you that in the shaft of the hair, which three structures you will find? Cuticle, then cortex, and medulla. Then just remember those three. Those three you must remember. Then the other layers present in the follicle, just read once or twice. Then if I ask you which layers are not present in the shaft, then you can answer. If you see it's not in any of those three, then you can say this is not the layer of the shaft.
Let's skip this one. Skip this part.
Types of hair. Two types of hair are seen in our body, vellus and terminal. Vellus are pale, fine body hair of children and adult females. Soft hairs, fine soft hair, that's the vellus. Terminal hair are coarse, long hair of eyebrows, scalp, axillary, and pubic regions. Those are thick and hard. Baldness. Two types of baldness occur. One is alopecia and another is true or frank baldness. Alopecia is the thinning of hair in both sexes after age 40. So after age 40, we start to lose hair, and that happens in both male and female, and that's true for everybody. Okay, and that's for alopecia. True or frank baldness is mainly genetically determined. If the father has bald, then the son will get bald. The chance is more. Okay, so it is a genetical disorder that can cause baldness. And just know that we know that baldness is a male secondary sex characteristic. We have talked about that. Baldness is a male secondary sex characteristic. And why baldness occurs more in male? The reason is a hormone that is called dihydroxytestosterone. Di is 2, right? Dihydroxy. We know that testosterone is male sex hormone, and dihydroxytestosterone is a precursor of male hormone, the inactive form of male sex hormone, and that is responsible for the baldness. DHT or dihydroxytestosterone. Temperature regulation. We know that one important function of the skin is the regulation of body temperature. when the body temperature increases, your hypothalamus is a structure present in the brain. Okay? Hypothalamus is a structure present in your brain, and hypothalamus can detect the temperature change and will send a signal to the sweat glands of the skin through the nerves, and will tell the sweat glands to release sweat or water. Okay? So when the sweating will occur, water will get out, it will take heat out from the body. Okay? Another action, hypothalamus also causes dilatation of blood vessels in the skin and allow more blood to flow into those areas. So this will occur if in particular part of the body the temperature increases. Like for example, if in your head part the temperature increases, more blood will go there and will take the blood out from there, and new blood will go, new water will go there and will decrease the temperature. So that is another way. But main way is sweating. This one is important. If I ask you that which brain structure is responsible for the regulation of body temperature, that's the hypothalamus. It sends signal to the sweat glands to release the sweat, chest nodule. That will happen if the temperature increases. Now, if the temperature, body temperature goes down, then what will happen? The sweat glands will constrict, and also the production of sweat will decrease. See here, what will happen? This is the sweat gland, and inside the gland you have the sweat here, and that sweat gets out from the body like this. Okay, this is the skin surface. So if the body temperature goes down, then you don't need sweating. In that case, what will happen? The tube will constrict, will get narrower, and when the tube will get constrict, you see here, if this tube gets narrower, then the sweat will not be able to get out, right? If it gets narrower, also this opening will constrict, will get small. So this whole thing will constrict, so the sweat will not be able to get out from the gland. So that is one way. Another is shivering might occur. What is that? Your body will start to shake, and when the body will shake, the muscle activity will increase, and that will increase the metabolism. You know that when you do exercise, your muscle activity is increased, and that produce heat. So when your body temperature goes down, then what can happen? Shivering or shaking of the muscles can occur, and that will increase the metabolism, will produce heat. So in those two ways, the skin and the muscles will try to increase the body temperature. Dermatitis. Itis, when you will hear the term itis at the end of any word, that indicates inflammation. Itis. Very commonly you hear this term, right? Like meningitis, conjunctivitis, right? Rhinitis, tonsillitis, pharyngitis, laryngitis, hepatitis, nephritis. You can hear gastritis, you can add. Okay? So, itis indicates inflammation of that organ. When we say hepatitis, that means inflammation of the liver. Hepatic indicates liver. Nephritis, inflammation of the kidney or the urinary system. Okay? So anyway, so dermatitis is the inflammation of the dermis of the skin. Make sense? Inflammation of the dermis of the skin. And dermis has how many layers? No, that's the epidermis. Dermis has how many layers? Yes, allowed. You're right. 2, right? Outer is papillary, inner is anybody? Reticular, right? outer papillary, inner reticular. I am repeating again. Outer papillary layer is formed by loose areola, right? And inner, I have talked about that already. Inner reticular layer is formed by dense irregular. Okay? So outer is formed by what? Areola. And inner is dense irregular. Dense irregular, yes. So now you tell me, that's a common sense, that microorganisms can multiply and spread in which layer of the dermis? Soft layer or hard layer? Soft. That's the common sense, right? Soft layer, soft tissue has more spaces. So the microorganisms can easily multiply and move, right? In hard, dense tissue, they cannot multiply or move. So dermatitis is the inflammation of the outer papillary layer of the dermis, because microorganisms cannot invade into the deep part, which is hard. Outer soft areolar tissue is soft, loose, so the microorganisms can spread this. How dermatitis can occur? What can cause dermatitis? Different ways it can occur. One is by infection, like microorganisms, bacteria or virus, they can do dermatitis. Radiation, like UV radiation. If you sit under the sun for a long time, you see redness of the skin. So inflammation, starting of inflammation can occur due to radiation. So radiation can cause inflammation. Mechanical irritation. If I scratch on your skin, then inflammation of the dermis will occur. That's the mechanical irritation. Chemical. Some chemicals can cause inflammation of the dermis, like poison ivy. So that's the dermatitis. So if I ask you that in which layer of the dermis dermatitis will occur or inflammation will occur, that's the outer papillary layer. It's the areola, right? Okay, now we'll talk about skin cancer, carcinoma of the skin. Three types of skin cancer are seen. One is basal cell carcinoma, then squamous cell carcinoma, and melanoma. Melanoma is the most dangerous type of skin cancer. So melanoma is the most dangerous type. Basal cell carcinoma is least malignant, that means least harmful, okay? Almost harmless. Now the good thing is that basal cell carcinoma is more common, that means least harmful one is more common, that is good, okay? And basal cell carcinoma is easy to treat. You can easily treat. How you can do that? You see here, in this patient's face, he got basal cell carcinoma, and you can surgically remove those cancerous cells or tissue, and then the patient will be fine. Okay, and no problem will occur. Squamous cell carcinoma involves keratinocytes of stratum spinosum in that layer, spinosum layer, and most common on scalp, ears, lower lip, and hands. In those areas, we see this type of skin cancer more. And how we can treat? Good prognosis if treated by radiation therapy and removed surgically. So what we will prefer to do is first you can see these cells are the cancerous cells. So you will surgically remove this part, okay? And then to make sure you can do radiation to kill surrounding cells too, just to make sure that sometimes cancerous cells you cannot tell by looking the color. Some cells you may think they are healthy, but they might be cancerous. So you need to. So what we usually do, we remove more tissues, surrounding tissues, and also we give radiation therapy to kill the adjacent cells. Melanoma involves melanocytes. So melanocytes get cancerous. Melanocytes start to multiply uncontrolled. Cancer is nothing but uncontrolled multiplication of the cells. Multiplication of the cells is fine because our body grows due to multiplication of the cells, due to production of new cells. That is normal. But when the cells start to multiply uncontrolled, that is the cancer. Okay? So in melanoma, melanocytes, those cells produce that dark to brown to dark pigment. Those cells will start to multiply abnormally and will produce melanoma. And melanoma is the most dangerous type, and you can easily diagnose by looking the color. In case of melanoma, you will see the color is black in most of the cases, or brown, tan, and sometimes it will be red or blue. But the color is different than the color of other two types of skin cancer. Okay, so it is not difficult, it is easy to diagnose. Now, highly metastatic and resistant to chemotherapy. How you can treat? You can treat by wide surgical excision. So if you see that this part has the cancerous tissue, but actually what happens, huge area, surrounding area also contains the cancerous cells. So in that case, you have to do wide surgical incision, and immunotherapy is helpful. What is immunotherapy? You will inject the antibodies, and that will find those bad cells and will go and get attached to them and will destroy them. Okay? So just I am telling you, I am not going to ask that question in the test. Okay? So in the test, for the test, important things here, that what are three different types of skin cancer. You need to know the names, right? Squamous cell carcinoma, basal cell carcinoma, and melanoma. Which one is the least dangerous? Basal cell. Which one is the most common? Basal cell, right? Which one is the most dangerous? That's the melanoma, right? So those are the type of questions I'll ask. Additional things I have mentioned just for you to understand and get better idea. Burns. The main problem of burn is two things, main problems. One is loss of water that can cause dehydration, and another is loss of electrolytes. Electrolytes are the chemicals, those carry electrical charges. Okay? So loss of electrolytes will cause electrolytic imbalance in our body. So two problems. Number one is dehydration due to loss of water. Number two, electrolytic imbalance due to loss of electrolytes. And electrolytes are extremely important for our body. Small electrolyte imbalance can cause severe consequences, severe problems, like your heart can stop functioning. okay, or start to behave abnormally. So those are the main problems of burns. Now, by looking the amount of damage of the tissues or skin, we classify the burn into 3 types: first degree burn, second degree burn, and third degree burn. If you see that only the epidermis, that outer layer of the skin, has been destroyed, that is the first degree burn. If you see that epidermis and upper part of the dermis, that means dermis is not completely destroyed but partially destroyed, that is called the second degree burn. If you see both epidermis and the dermis have been destroyed, that is the third degree burn. Entire skin thickness has been damaged or destroyed. That's the third degree burn. Okay? How you can tell which one is what? In first degree burn, you will see the redness, localized redness, edema, and pain. So if you see those things, that's the first degree burn. In second degree burn, blisters, white patches will appear, will be seen. In third degree burn, entire skin has been destroyed. In that case, the patient will feel no pain, no edema will be seen. Why? Because the nerve endings have been destroyed completely. So when the nerve endings are destroyed completely, the cutaneous receptors are destroyed, the person will not feel any pain there. Okay? Because the entire skin has been destroyed. No nerve endings, no cutaneous receptors are remaining there. Okay? That's why you will not feel any pain. In this case, skin drafting is essential. You have to take the skin from other part of your body and will transplant that skin. Here, you see this patient's hand, both first degree and second degree burns are seen. In case of first degree, you see the redness and swelling. In second degree, you will see white patches, blisters are present. Okay, so that's the second degree burn. Now I'll show you third degree. Are you ready to see? Okay, so don't get scared. That's the third degree burn, and you see that although the skin is still attached to the body, but actually the entire skin is destroyed, has been destroyed there. It will eventually come off, and you have to do the grafting, take new skin and put it there. Okay, so we have talked about the burns. Now we'll talk about the nail. I don't like this part. This is my least favorite part. So I won't talk much, just quickly I'll go over. I know some of you like the nail and take a lot of time to take care of the nail. I don't care for the nail. See, sometimes girls they sit in the, what's that called, the places? Yeah. Yeah, sit hours after hours. Okay, so nail, if you see the nail has different parts. Body, feet is root, nail folds, hyponychium, nail bed, and lunula. So those are the parts. So if you see the nail from the top, from above, this is the P S, and these are the nail folds. lateral and proximal nail pole. This is the proximal, that means towards your body, proximal, and these are lateral nail poles. Okay, and this part is the body of the nail, and body of the nail rests on nail bed. There is a bed under the body. So this, if you make a section like this is the body. Like if you cut here like this, you can see the body, and under the body, this is the nail bed. So the body rests on the bed. Then the proximal part of the nail, you see a white crescent. That white crescent shaped white part is called lunula. And then nail root is the part that from the body, that part you don't see goes inside the finger. That's the nail root. So you don't see that part. You see the body and tears. So this is tears, this is body, this is nail. Okay. Just last thing, small amount of tissue that connects the free end of the nail to the fingertip. That is called hyponychium. And a small amount of tissue that is here connects the nail bed to the finger. That's the hyponychium. So those are the small amount of tissue that connects the nail to the finger. Hyponychium and hyponychium. Okay, so that's the first part of the integumentary system.
Yeah, I can just see.
Oh, actually we are done the integumentary system, not the part. This is the whole entire system. So integumentary system is done. You have learned about the skin, you have learned about hair, you have learned about the nail. Okay, so those are, you have learned about the glands present in the skin. That is also very important. Different types of glands, how they secrete the chemicals. Okay. So let's take a short break. Okay, then we'll talk the skeletal tissue, but we'll try to finish quick.